just to introduce myself, my name is Beth and I am an OET teacher and also Assistant Director of Studies here at West London English School. So today, the lesson that we are going to be doing is looking at the speaking subtest of the OET. And we're looking specifically at a patient-centered approach. Now, this is something that is an important part of the marking criteria. And it's basically being able to relate to the patients, to understand them, to empathize with them, to reassure them. So that's something that we're going to be looking at, particularly at some language and intonation in terms of how to do that. So for those of you that don't know, or just to refresh your memory, the speaking subtest has 2 consultation role plays. That is you and an interlocutor. Now, the interlocutor is someone who just works with you speaking, but they are not marking you. They are purely listening to you and doing the role play with you. The OET speaking role plays in your actual exam are sent to Australia and they are marked there. So while you're in the role play, it's just you in a room with the interlocutor and you do your 2 speaking role plays. So the role play starts with warm-up questions. So for example, the interlocutor, they're just trying to get you to be at ease. So they're asking questions like, oh, are you a doctor or a nurse? How long have you been in this country? These kinds of questions, just to get to know you a little bit and to relax you. And then you have 3 minutes preparation time where you have the card in front of you and you can underline, highlight, make any notes that you want to. Now, in this 3 minutes, you are able to ask questions to the interlocutor. And the questions that you might want to ask, for example, are maybe, how do I pronounce this? Yeah. You can't ask them too much advice in terms of, oh, what should I do about this? You can't ask them, how do I begin the role play? But you can ask them if there is maybe a word that you are not sure about or about pronunciation. This 3 minutes is also time for you to really plan what you're going to do and the structure that you're going to have. So you will start the role play and then the interlocutor will reply and they have their card as well. So they will go to their task and then you come back to your task and then they go back to their task. And it's really important in these 3 minutes that you really plan what you're going to say and how you're going to say it. And you can think here about the patient that you have. For example, are they anxious? You know, do they seem worried? Does it have language like reassure the patient? So you'll know a little bit whether it's maybe someone challenging or maybe not. And you can also think about how you'll open the role play, because sometimes you need to introduce yourself and you might need to ask them for their name. And other times, maybe you have just examined the patient, so you don't need to introduce yourself. We're really going to look at opening role plays today, as that is all part of being patient-centered. Now, I should mention that in those 3 minutes as well, you can ask the name. And the reason that this is a nice idea is because imagine that you have just examined your patient. You're going to start your role play after examining them. And if you've asked the interlocutor your name, you might want to begin with something like, so Catalin, I have examined your leg and blah, blah, blah. By using the patient's name, already you are being patient-centered. So it's a nice time to ask for their name. So after the 3 minutes, you have your actual role play, your 5 minutes, where the interlocutor records the role play. And because there's 2 consultation role plays, you then have another 3 minutes and another 5 minutes. In total, the test will take roughly about 20 minutes. So These are the kind of cards that you will get for the exam. Here we can see one, which is a doctor, and we can see the 5 tasks underneath it. Behind that, we can't see it properly, but this is the patient card. Now, in the exam, you do not see the patient card. You only have your specific card. So in today's lesson, we're going to think about what being patient-centered actually is. We're going to look at how to open a role play. We're going to think about dealing with difficult patients. And finally, we're going to look at some language. Okay, so some language to help you be patient-centered. So I'm going to give you a minute or so. Look at these questions and think, what do you think? Is the answer yes or no for them? Now, while it does say doctor here, this applies to all medical staff, all professions. So you can, if you're a nurse, change it to nurse. If you're a pharmacist, I think both the patient and pharmacist have an understanding. Let's go through the answers. So the patient is considered to be the expert of their own disease. Yes. Now, if, for example, I have the flu and someone else, a different patient, has the flu, we might still have different symptoms. So for myself, I know that maybe I've had a runny nose or I've had a sore throat, or maybe my muscles have been really aching. So I am the expert of my own disease, my own illness, even though obviously as doctors, nurses, as medical professionals, you also are an expert, but I'm an expert of my own disease. Both the patient and doctor have an understanding of their symptoms. Well, yes, this is true as well. Again, just like I said, the patient knows about themselves, but of course the doctor or whoever, the medical professional, also knows about this. Now, patients and doctors speak more or less equally. Yes, this is true. Now, just because you are in a speaking exam doesn't mean that you're not also being assessed on your listening. And part of the marking criteria for speaking is that you're also listening and responding to the interlocutor. It's not just about you speaking, and showing off how wonderful your English is, which I'm sure it is. It's about having that balance, still listening and responding. And doctors control and guide the consultation. Well, yes and no. That's why we've got not quite here. Of course, the medical professional needs to be in control. You need to be the one, who is being a bit firm. Maybe if you have a challenging patient, someone who's angry, you still need to be firm. You need to be in control. But at the same time, you're gathering so much information from the patient that actually, in a way, you have to listen to the patient for them to guide the consultation. They have come to see you, and you need to wait and see exactly why they've come to see you. So a little bit of both there. Basically, patient-centered is that the patient is in the center and everything is about them. It's not about your agenda, it's about the patient's agenda. So patient-centered means the patient is the expert of their own disease. So you need to find out the symptoms from the patient. Don't give them their symptoms, try and find it out from them. So we need to think about questions for this. Now here I have an example of a role play. I'm just going to give you a minute or so to read it and answer the question, do you think the doctor is patient-centered? Yes, is the answer. This doctor is definitely patient-centered. Now you can see, if you just look at the language of the doctor, they're saying, uh-huh, I see. Okay, I'm sorry to hear that. It sounds horrible. The doctor is really listening here. He or she is not being intrusive. They're not asking a lot of questions yet. They're letting the patient speak. And then eventually down at the end, we can see some questions where the doctor is finding out some information from the patient that the doctor needs to know. But I think you would agree that the doctor here is definitely patient-centered. Now, I want you to think about yourself as a healthcare professional. And are you patient-centered? Now, I'm going to give you a couple of minutes to really reflect on yourself. And you can mark yourself between 1 and 5 for each of the points here. So for example, if you think that you talk more than the patient, give yourself a 1 or a 2. If you think the patient talks more than me, go for a 4 or a 5. So I'll give you a couple of minutes to have a read through these. Okay, well, hopefully you have had a look through those and learned maybe a little bit about yourself. Now, hopefully you are already patient-centered, but of course it depends where you're from. And in some cultures, it is more important in society to be doctor-centered or nurse-centered. So this is something that depends on you personally and depends on where you are. However, it is important that you remember that for the OET, you need to be patient-centered. So you need to let the patient ask the questions, guide the consultation, and you're there to help them and support them by still finding out that information yourself. But yeah, as I said, being patient-centered is important for OET if you want to get high marks. Now, looking at that last point about closed questions and open questions, you might be thinking, what are these? And this is something that we are going to look at later on. In fact, we're going to look at them right now. So open questions are when you start with something that the patient can answer very, very openly. So for example, how have you been feeling? The patient cannot reply with yes or no. It's a very open question. I'm not even asking about a specific illness. I'm not saying, oh, how is your throat? Or how is your cold? How has the flu been for you? Something like this. It is just so general. How have you been feeling? And when we're in class, we always talk about this kind of upside down pyramid. We start open and we get more and more closed as the consultation goes through. So we've started with our very open question, and then we're getting a little bit more specific. So can you tell me a little bit more about that? I'm slowly learning more from the patient. And then I get even more specific, but it's still not a closed question. It's not a yes or no question. It's an open question. Like, have you had any other symptoms? Now, this is so important for gathering information, and it's something that you must do in OET, is listen gather all the information, and then you can start to talk about maybe your findings and maybe diagnosing or offering treatments and this sort of thing. So now that we know quite a lot about the patient, we can ask a closed question, maybe something like, do you have any muscular pain? And then we can get even more specific, like whereabouts. So if they say, yes, I do, then you say, well, where? Yeah, whereabouts just means where on your body have you had the muscular pain? So here is a consultation. And there's some questions down here at the bottom. So as you're reading this, I want you to think, does the doctor follow the question pyramid? Does he start or she start with open questions and go down into closed questions? Does Dr. Lawson use multiple questioning? Now, this is when you are asking more than one question at a time. For example, how are you feeling? Are you okay? Yeah. 3 is, does the doctor encourage the patient to use their own words? They're not saying, have you got a sore throat? Then the patient is going to say, yeah, I do. Whereas if you say, how is your throat? Then the patient can say sore. And this is them using their own words. An accurate description is question 4. And 5, does he ask specific questions for clarifying? So I'll just give you a minute to read through this and answer those questions at the bottom. Okay, so does Dr. Lawson follow the question pyramid? Does he or she start with an open question? Are you still having them? No, this is the closed question. Not good. We haven't started open and got more specific. Does Dr. Lawson use multiple questioning? Yes. She says, how long have you been having them? A few days, a few weeks? Don't do this in your exam. You need to ask a question and then pause, wait for the answer, then ask another question. Does Dr. Lawson encourage the patient to use his or her own words? I don't think so. We can see the doctor says, do you have a high temperature? And he says, yeah, I've had a high temperature. So again, the doctor is almost putting words in the patient's mouth. So does Dr. Lawson get an accurate description of the patient's problem? Well, no, not really, because the doctor has guessed everything that the patient has. And does the doctor ask specific questions for clarification? Well, they do ask specific questions, but this isn't for clarifying. If you look at the bottom, do you have any aches? It says, yeah, I do. And the doctor interrupts, aches in your back and aches in your joints. So it's not really clarifying, but it is specific questions. So don't be like this doctor. Okay, here we've got a different consultation and the same questions. I'll give you 30 seconds. Okay, so we can see here, does Dr. Smith follow the question pyramids? Yes. We start with a nice open question. How are you feeling? And then we get, can you tell me a bit more about the pain? Do you have any other symptoms? And then we get more specific. Do you get any headaches? And then we go open again. Can you tell me a bit more about those, meaning about the headaches? And then we're still continuing to be open. Any aches in any other parts of your body? The doctor doesn't use multiple questioning. We can just see one question in each speaking turn. And the doctor is encouraging the patient to use their own words because of all of those open questions. So I would say that yes, Dr. Smith gets an accurate description of the patient's problem, and he or she is asking specific questions for clarification. So this is definitely a good example. Okay, so we're going to look at opening the role play. You are going to see some different speaking cards. I will give you a minute or so to read through the role play cards, and then we'll go through the questions at the bottom about opening the role play. Now, in 3 minutes, remember, you need to find out, do you know the patient? If it says that you are the doctor of the patient, or maybe it's a GP clinic, sometimes it says your patient has come to see you with these symptoms. So do you know the patient? Or are you meeting them for the first time? In which case you probably need to introduce yourself. Maybe it's a home visit or you're a specialist. Are you at the beginning of the consultation? Again, in which case you would need to introduce yourself and maybe ask their name or how they want to be called. And have you already examined the patient? So maybe you're in the middle of the consultation. Okay, so you've got 1 minute to have a look through this. Okay, let's look through this then. So we can see the setting that this is a home visit. It doesn't say of your 50-year-old patient, so we can assume that you don't know the patient. Are you meeting the patient for the first time? Probably yes. Are you at the beginning of the consultation? Well, look at that first task, and it says find out about the initial attack. So you are definitely towards the beginning of the consultation. You could just start by talking about the initial attack, or you could start by introducing yourself. Either option is okay here because there's nothing specific that tells you exactly whether you need to introduce yourself or not. Have you examined the patient already? No, you haven't. There's nothing here that talks about examining the patient. So do you need to introduce yourself? Well, for this one, you definitely could introduce yourself. It wouldn't be a problem. But you could also just start by saying, okay, so I understand that you've recently been having some problems at work. Can you tell me a bit about that? And then you're starting with an open question. So either option is fine here. Let's have a look at a different example. Okay, so do you know the patients? Well, we can see that this is in a GP surgery and you are a practice nurse. So the chances are that you don't know the patient. You possibly would, but I would say You probably don't in this kind of situation. Again, because it doesn't say you're a practice nurse and you've been advised your patient. It's not about your patient, it's our patient. Are you meeting the patient for the first time? Probably yes. Are you at the beginning? Well, definitely. If we look at task 1, explain the purpose of today's discussion. So you are right at the beginning. You haven't examined the patient because of that first task is the introduction. So yes, you do need to introduce yourself here. So you could begin here by saying, good afternoon, I am Nurse Beth, and I'm here today to talk to you about blah, blah, blah. Yeah. Let's have a look at another example. Okay, so do you know the patient? Well, the chances are that yes, you do. Because if we read the beginning, it says you're talking to the parents of a 1-month-old boy who was admitted to the hospital yesterday. And now we've got the blood test results that indicate he's suffering from biliary atresia. So do you know the patient? Yes. Are you meeting the patient for the first time? No, you met them for the first time yesterday. Are you at the beginning of a consultation? Probably yes, in this case, because you are explaining the prognosis from the results. Have you examined the patient? Yes, you have. So do you need to introduce yourself? No, you don't, because you already know the patient. What you might want to do is start from the beginning and say, oh, hello, it's good to see you again, and then go into the first task. Here's a different one. Okay, so do you know the patient? Well, the chances are you do know the patient, the 80-year-old, but you don't know the son or daughter, the child that you are speaking to. So are you meeting the son or daughter, it should be, for the first time? Yes, you are. So you probably would need to introduce yourself here. Are you at the beginning of the consultation? Well, it says the first task, find out what the son or daughter knows about post-operative complications. So it could be that you've already come in and introduced yourself to the person in the ward, or it might be that you just go straight into it and ask what they know. Now, the examining the patient doesn't matter too much here because you're talking to the son or daughter. So do you need to introduce yourself? You can do, but you don't need to. With this example, it doesn't matter because that first task is quite specific, so you can just go straight into it, or you can introduce yourself as the nurse on the ward and then find out what you can call the son or daughter and then go into the first task. Here's another one. Okay, so do you know the patient? Well, you are the doctor in a GP practice, and as it says you're seeing a patient who has frequent migraine attacks, the chances are that you do know the patient. So are you meeting the patient for the first time? Probably not, but it doesn't matter too much if you act as though you haven't met them before. Are you at the beginning of the consultation? Definitely, because that first task is greet the patient. Have you already examined them? No, not in this case, because first of all, you greet the patient, so that is saying hello. So do you need to introduce yourself? You do. You definitely need to greet them by saying something like, oh, good afternoon, how are you feeling today? Or you could introduce yourself as though you've never met them. You know, good afternoon, I'm Dr. Beth, how may I address you? Something like this, which it counts as greeting the patient. Okay, here's another one. Well, hopefully you've already managed to find out the answers for this, because we can see that the setting is the emergency department. However, it does say you've checked his vital signs, which are within normal range. So, do you know the patient? Like, have you met them before? Well, yes, you have met them because you've already checked the vital signs. So you're not meeting the patient for the first time. You probably met them for the first time today, but you've already seen them because of the examination that you've done. So you are at the beginning of the consultation because your first task is greet the patient, ask what happened. You have examined them because you've checked their vital signs. And do you need to introduce yourself? You don't need to, but you do need to say hello and greet the patient, because that's what the first task is. Okay, we're going to move on. So we are now going to be looking at how to deal with more challenging patients, which do come up occasionally in the test. So here is the situation. I want you to have a read of it and think what tells you that the patient is going to be a challenge. Disagrees and demand. Now, if the patient disagrees with your diagnosis, you can imagine that they are going to be a little bit of a challenge. And if they demand further tests, they're really going to make you work for it. So with this, you know the patient's going to be difficult to deal with, and that helps you prepare a little bit with what you're going to say and how you're going to help. So here is a conversation. I'll give you some time to look through it. This is a good example. See if you can find some examples of good language in here. Hopefully you've found some good examples of language in here. So we can see some sympathetic language. I do understand why you would think that, but thankfully it really is just a case of the flu. And we've got a lot of reassuring language here as well. So please don't be alarmed. I can assure you, like, I'm sure you'll feel better. So all of this type of language, if you are using it in your test because you need to be reassuring or you're dealing with someone challenging, this is all going to help you with the marking criteria, because you need to show that you can sympathize and empathize with the patient. And this person is definitely doing that. And hopefully with that intonation as well, you'll be able to see that that they're being very empathetic. So for example, with that last line, say, but I'm confident you'll be feeling much better in a couple of days. And by using that kind of nice, kind, calm tone of voice, it will make the patient feel more at ease, and again, make it patient-centered. Here's a different situation. Okay, so we can see here that last line, the patient becomes annoyed and is short with you. Now, if someone is short with you, they don't want to answer your questions. They just snap one-word answers and this kind of thing. So have a read of this, see if you can find some good language again. Now you can see here that this patient is definitely a challenge with the kind of language that they're using. They're definitely being very short, but I think you'll agree that the doctor is very kind here, very patient. So we've got some indirect language at the beginning. I'm afraid that I can't do that. And by saying I'm afraid, it's like, I'm sorry. So you're trying to put the patient at ease. We've got some sympathetic language. I understand. I do understand your frustration. And then what we've got here, which I think is really good, is the doctor is providing options for the patient. So saying, you know, how about we look at a couple of other options? You know, do you think you could take a taxi to come here? So by doing this, you're putting the patient at ease. Here's a different situation. And we know this is a difficult patient. We can see it's an anxious parent. They demand to see someone immediately and they become upset when you tell them the doctor isn't available. So let's have another look for some good language here. Now again, here we've got a very kind nurse. They're very patient with the patient. So the nurse needs to apologise because the patient has been waiting. And we've got some different ways of apologising here. So I'm sorry to have kept you waiting, and I can only apologize. And some sympathetic language, like I do understand. And then we've got some explaining, because here, of course, in this case, the patient is unhappy because they've been waiting. So it's important that the nurse explains why the patient has to wait. And the sometimes with the patient and the patient card, it's very kind of demanding, where the patient has to keep going on at the nurse or the doctor. So what we can see here is move the role play on. So the nurse is saying, I do understand, but if you'd allow me to take some vitals, and the nurse is very kindly insisting that the next stage begins, the next stage of the consultation. Now, it's important that you use a range of language in your speaking, again, because of the writing, the speaking criteria. So here we've got some different language, but we're really going to focus on that in a minute. One more situation. So a patient challenges your advice. They don't agree with your advice, and they don't want to stop running. So we know here again, we've got a difficult patient. Have a look for some good language in here. Let's have another look at some good language here. So the nurse is empathizing, saying, I know it isn't what you want to hear, but it will be better for you. And I do understand that. So we've got a range of language here. The nurse isn't continuously saying, I do understand, I do understand. They're using a range of language. And explaining the benefits of the treatment in this case. Yeah, so it will be better for you and you'll really benefit. You're trying to persuade the patient here. And this patient is wanting treatment. So the nurse here is explaining the disadvantages or the drawbacks. So by explaining, you're also being patient-centered, just to ensure that they fully understand. And we're offering other options, just like that previous example that we had. So here she's saying, would it be possible to do some other exercise? You know, giving options like swimming or cycling. And we've got another situation here. We can see a patient is reluctant to change their lifestyle, so they don't want to change it. They need to reduce smoking, make changes to their diet, and incorporate some exercise into their routine. Let's see what good language we've got here. So this patient really is a challenge. We can see the patient saying, I'm not sure, no. I don't have time. And the nurse is being very encouraging with a difficult patient. So we've got some more negotiating here, like how about cutting down? Or how about having a salad? How about going for a brief walk? Now, using that structure of how about is really good for your negotiating and being patient-centered. We've got some really nice encouraging language here saying, oh, that's great, that's brilliant. So even though the patient is not very enthusiastic, you can see here, I suppose I could give it a go. The nurse is still being positive. That's great. Yeah. And involving the patient here by asking an open question, like, what do you think you could manage? Get the patient to give their own language to you, so that, again, you're not just offering them ideas, you're asking them to think of the ideas themselves. So we're going to go through just some of the language that we've had today in all of the examples that we've seen. So language for empathy. And we're going to go through and think about the stress here. So here, the words in bold are the ones we emphasize. I can see that must have been difficult for you. Try and say it now, or watch this video back later on and have a practice at this, because intonation and stress is something that comes under the speaking criteria under intelligibility. So it's really good if you're able to use these types of phrases as well as having really good pronunciation with them. Let's look at the next one. I appreciate you telling me this. I can see that this has been very difficult for you to cope with. I can appreciate how difficult it is for you to talk about this. I can see that you are quite upset. I understand this must have been very upsetting. I know how you must be feeling. I'm sorry to hear that. I do understand. Now, it sounds a little bit almost false when we're going through it in that kind of a way with stress, but it's really important that you get this in your head, that you remember this kind of language and remember where the stress should be, so that when it comes to the exam, you will do it a lot more naturally because you've already remembered and you've already got it in your head. Let's look at some language for reassuring. And what I'm going to do here is give you 30 seconds to think about how you might put the stress and manage your intonation here. So read through these, and if you're on your own, or even if you're on the bus or with someone with someone else, try and say them out loud. Okay, so I'm just going to give you some examples here. You have no need to worry. This clinic has an excellent reputation and your health is our utmost priority. I'm a qualified nurse with much experience. Please don't worry. Statistically speaking, the likely outcome for you is excellent. This is the best option, I assure you. We'll do all we can to assist you. I can assure you that there's nothing to worry about. Okay, so again, at home, when you've got time, go through these, practice them. We're going to look at some indirect language. Now here we've got some different options, especially for if you're trying to get someone to explain something to you or you want to ask them a question. Using indirect language is very polite. I want you to just have a look through these and see if you can think of any ideas that would go at the end. For example, would you mind if I take some vitals? Have a read through them now. Think of something to go on the end. And here are some options that I've got. Would you mind if I asked you some questions to get a better understanding of your condition? This is a really nice question to ask towards the beginning, just to, again, show that you're including the patient and that you're thinking about them. I mean, they have to say, no, I wouldn't mind, but it's nice to ask anyway. Oh, the second one. If you don't mind me saying, I've noticed you've put on some weight since I last saw you. I mean, you can imagine this might be a difficult patient to deal with potentially. In your own time, could you describe your symptoms to me? I'm afraid I need to ask you some personal questions. Is that okay? So you're asking permission here. You know that you need to ask them personal questions, but it's nice to ask if you can ask them those questions. Would you mind telling me about the difficulties that you're facing? Could you tell me about the difficulties you're facing at home? So some of this is direct and some of this is indirect language, but all of these are very polite. They are already empathetic. You're already thinking of the patient even before you ask the question. And we've got some language here for making suggestions. So you could consider taking, or you might want to consider taking. You may want to think about. One option is taking. Another possibility is, an alternative is, alternatively, you could think about, how about, what if instead of you could, why don't you? Okay, now the reason that I am reading through all of these, I know that you can see them on your screen, but the reason I'm going through them is also just for your pronunciation, for your intonation, and to show the kind of pronunciation really that you need in the exam. So you're speaking quite slowly, very clearly, and with empathetic intonation. And let's finally look at some language for negotiating treatment. What do you think we can put in the gaps here? So here are my options. Do you think that's manageable? That pronunciation, manageable? Yeah, do you think that is manageable? How do you feel about that? Do you think you can manage that? Does that sound achievable? Now, if you look at that last one, you might have had an answer like, does that sound okay? Or does that sound all right? Does that sound good? So all of that language is fine. But by using a word like achievable, you're showing a high range, a high level of English. So using this kind of vocabulary is going to be beneficial for you. And we've got some other options here. What do you think you'll be able to do? What do you think is an achievable target or a realistic target? What is your preferred course of action? What treatment do you think would suit you best? Oh, we've got that one again. Let's say it again. What is your preferred course of action? All right, that is everything from me today. So I'm just going to tell you a little bit about the courses that we have here at West London English School. So we do have some online packages for you. So here you can see a writing package that we have. In our packages, you get video lessons, which are being taught by our OET teachers here at the school. We also have a writing correction service, which is where we send you case notes, you write your letter, send it back to us, and we will give you feedback, which includes the marks of the writing criteria. So a lot of people go for this option. The difference between the writing package and the writing correction service is that the writing correction service is only letters. You don't have the actual lessons included in that. Speaking, what we've been doing today, we do have a speaking course, which includes role play practice with a teacher. So it's almost as if you are in the actual test and you do some speaking practice with feedback. And within that, you also get 5 video lessons going through different things, a bit similar to what we've done today. So some different types of language for empathy, for reassurance, and lots of things as well that we haven't covered today. There's not enough time for everything here today. We've got a reading package as well and a listening package. Again, both our listening and reading packages have got video lessons and also mock practice tests. Now, West London English School is a premium preparation provider for OET, and that means that we have done a lot of preparation and training to be able to create our own OET materials. So when you take our courses, it won't be material that you have seen anywhere else. If you've managed to find something online or you've bought a book or been to another school, it's not the same material that you're going to find as you get with us, because we create our own as well as using other practice papers. So these are our bigger courses online for nurses and for doctors, and they include all 4 subtests for the OET. There are lots of video lessons, mock practice tests, and writing feedback and speaking lessons. So the platinum is something that a lot of students go for just because it is the complete package. You get everything you need with that. And after going through the platinum course, you should definitely be able to pass your OET test, providing that you start with a higher enough level of English. These are our teachers. We've got Harmy there, who is our OET course director. You've probably seen him on Facebook Live on OET All Stars before. I'm in the middle there, and then we've also got Catalin, who is an OET speaking interlocutor. So if you do choose to book a speaking course with us, there's a high chance that she will be working with you and that she'll be practicing as an actual interlocutor with you. So it's great to have her on board. So thank you for watching. If you are around in London or online, send us a message, send us an email, or pop in and come and see us. We love talking to people about OET. So yeah, do ask us any questions that you have, and Harmy will be back here next week at 10 o'clock UK time with another live lesson for you. So thank you very much, take care, and I will see you in a couple of weeks.